Hello, this is Dr. Kevin Connors again with Module 3 of your Stop Fighting Cancer course. This is on finding the cause, dealing with the cause, why we should deal with the cause, why we should address the cause, and trying to figure out why the medical profession doesn't even talk about this. I still don't know. I don't have the answer to that, but we'll talk about it a little bit. So finding the cause is an important thing. It always has been an important thing to me when we started seeing cancer patients back in the 90s. It's always been important to me as a functional doctor because it just makes sense to me. It's just part of my philosophy. It's like if we don't deal with the cause, then how are we actually going to deal with the problem? We talked about that a little bit in the Band-Aid approach. But that I don't know. It just is part of who I am with as my core. We got to deal with causes, and I know that we should use that word in the plural because there's always multiple causes. But ultimately, there is one thing that ends up getting inside of a cell, and we need to deal with that if we can. So, in order to understand that, I think we have to be on the same footing in understanding what cancer is. So cancer is one thing that gets inside of a cell. It could be an oxidative product, like some sort of oxidizing agent, like a poison, like a pesticide or a chemical or an herbicide. It could be a bacteria or a virus or a fungus or a mold or something like that that gets inside of a cell. It affects the nucleus. So normally your cells divide. Most of your cells. Your neurons don't, and most of your cardio cells don't readily go through this process. That's why cancer in the neurons themselves is rare, and in the heart is rare. But in the glial cells in the brain is different. So, long story short, simplify the physiology here. Normally, your cells will undergo a reproductive cycle. So your skin cells, about every 6 to 12 weeks, will reproduce another cell, and then another 6 to 12 weeks, that cell reproduces another cell, and eventually the mother cells, you could say, die off through a process of normal, natural, programmed cell death that is called apoptosis. That's a healthy cell death. So there's different ways that cells die. Cell death through pathology would be lysis. So if you were poisoned, you die quickly with a poison because you have massive cell death, massive cell lysis. So lysis of a cell is basically an exploding of a cell. All the cell parts, all the different organelles and cytoplasm inside that cell are spewed out over into your body. You have all this waste production, and through this cell death, you die. So if it's death of your arterial cells, your endothelial cells, you could have massive explosion and blood loss, and you instantly die. It depends on where that poison is acting on, what cell line that's acting on, etc. Cell lysis actually takes place when a person goes through chemotherapy. So any pathological death of a cell is called cell lysis. Normal programmed cell death that takes place through normal cell division and then the mother cell dying off is a different type of cell death called apoptosis. Totally different process. The cell goes through these what are called blebings, which is actually these in-pocketing of the cells and then walling off and piecing apart, and literally through the use of different organelles, one of them lysosomes inside the cell, you end up reutilizing a lot of the cell components. So it isn't an exploding of the cell and it all breaking up and you have to deal with waste products from that cell death. It's basically a recycling of the cell material and reusing of the cell material of the body. It's a very efficient process, this apoptotic process. And there's different things that stimulate apoptosis, and there's things that can hinder apoptosis. So there's actually a couple parts to a cell line going into a cancerous production. Something gets inside the cell, affects the nucleus, and instead of that cell, let's use your skin cells again, instead of that cell line reproducing every 6 to 12 weeks, now it's reproducing every 6 to 12 days or worse. So if it's reproducing every 6 to 12 hours, well, that would be a very aggressive cancer. So the aggressiveness of the cancer is how fast is it reproducing. So the aggressiveness of the cancer is how fast is that rate of replication. And then what also happens in a cancer cell mass is that the mother cells are not going through apoptosis. So they are slightly deformed. They look different on a slide. They're not healthy, normal cells. They're rapidly reproducing, and they're not dying. So they're not going through lysis, they're not going through apoptosis. So the purpose of chemotherapy is a poison, an oxidizing agent, that hopefully, because this rapidly growing cell mass is more metabolically active, it's, you could say, hungrier. Now this hungrier cell mass will uptake the poison faster than a healthy cell, which isn't quite as hungry because it's not as metabolically active. So the idea of chemotherapy is that since the cancer is hungrier, it's going to take up the poison more readily, and the poison will kill the cells. Well, of course, some of the healthy cells are going to take up the poison too, and they could die as well. Of course, they're healthier, so the chance of them dying is a little bit less. That's the idea of chemotherapy, and in general, it can work. But a person can have ill effects of it because you have death of healthy cells and etc. There's other things, so this talk isn't about chemotherapy. But that's the idea. If we understand what cancer is, we can understand why it can be important to address the cause. And I've said in other videos that, wow, they do all this research on what causes cancer, charcoal foods to newspaper ink to pesticides and herbicides and everything. But then once a person is diagnosed with cancer, and if they're astute enough to go, well, Mr. Dr. Oncologist, what's the cause of my cancer? Usually they get a blank stare, or, well, we just don't know, or you just have bad luck, or you have bad genes, or whatever it is. It's very rare that we ever hear anybody was told that they have a certain cause for their cancer, unless they have a BRCA gene defect and then it's blamed on genetics, or they have positive HPV or something with uterine or some sort of vaginal cancer and it's blamed on that. But typically, cause is never investigated. And partly it's because they don't really have a treatment. That's not really part of the protocol. Understand, practice of medicine, good and bad, is that really the protocols in the practice of medicine called the standards of care, really written by the pharmaceutical industry because they have a quote-unquote treatment for it. So when there's no treatment for pesticide exposure causing the cancer, well, we don't deal with that. So that just doesn't exist in their mind. And that's unfortunate. So understand, when you talk about cause, you really have to understand what cancer is. Something got inside that cell, affected the nucleus, and it could be a plethora of different things. Got inside the cell, affected the nucleus. Now that cell line is going through rapid replication, and it's not going through apoptosis. Now, here's a little side note. When women, especially with cancers that are ER positive, PR positive, or HER2 positive, what does that actually mean? Does that mean estrogens are the cause of the cancer? Therefore, dropping estrogen down to nothing with the aromatase inhibitor type drugs is going to cure the cancer. Well, no. Estrogen is not the cause of the cancer. Estrogen didn't get inside the cell and cause the cell to go through rapid replication. So when we're speaking about cause, we're talking about what affected the nucleus to go into rapid replication. When we're talking about hormone-positive cancers, That is talking about what's hindering apoptosis. So you have different, so a cell goes through normal programmed cell death, apoptosis, because of an internal factor, internal to the cell, and an external factor, external to the cell. The external factor has to do with the cell membrane. So your cell membranes have thousands of different receptors on those membranes that do different things. On the cell membranes, you have what are called apoptotic receptors. One of the types of apoptotic receptors is called an ADOL receptor that bad estrogens, quote unquote bad estrogens, can attach to that receptor and block apoptosis. So when a person is ER positive, HER2 positive, or PR positive, it's shown via investigation and testing in a laboratory that that person's cells, cancer cells, have those bad estrogens attached to those receptors blocking apoptosis. It's not the cause of the cancer, but it is causing a decrease in apoptotic function. So the cell isn't going through normal programmed cell death. So decreasing bad estrogens would be extremely helpful in overcoming cancer with these people. Now, do you need to go on a medical drug, apoptotic hormone blocker? Well, that's questionable. There are some natural hormone blockers out there. I list them in my book in detail that you can look at and investigate and start utilizing those. You could even use those if you are going to go on an aromatase inhibitor medical drug. Now, a lot of women don't like those drugs. A lot of men with prostate cancer don't like androgen deprivation therapy. You can reduce these bad hormones, quote unquote, the ones that attach to those receptors, through natural means. It's never going to be as good, quote unquote, as if you took the drug and completely wiped out all your hormones. But there's a lot of side effects of that and negatives of that too that a lot of men and women don't like. So look at that, investigate that. But that's not fixing the cause. It's fixing part of the cause, you could say. It's affecting, the hindrance of apoptosis, but it's not blocking the replication piece. Hopefully that wasn't too much information. But so understanding cancer helps us understand why we want to look at cause. So why does cancer continue to grow? I thought my immune system was supposed to knock down this cancer and destroy it. Is it because I have an unhealthy immune system? Is that why it's continuing to grow? Well, we talked about one possible reason why it's continuing to grow, in that apoptosis is not taking place because of possible hormone interaction. But let's say I have a cancer that isn't hormone related, so that's not the reason. Well, remember, cancer is your own cells. So it is self-tissue. Now, normally in self-tissue, your immune system doesn't attack self-tissue, otherwise we'd all be dead. So self-tissue is blocked, your immune system is blocked from attacking self-tissue because your T cells, one of your natural killer cells, your immune cells, have this little receptor on it that your self-tissue cells attach to that receptor and turn off T cell attack to self-tissue. That's how self-tissue is preserved or protected from your own immune system. And the immune system then, that's the smart pack of the immune system. So the immune system will then just attack things that are not self-tissue. The immune system is not supposed to get rid of pesticides and herbicides and chemicals and heavy metals. Your immune system gets rid of bacteria and viruses and mold and funguses and biotoxins. So your immune system kills biotoxins, and then your detoxification process gets rid of heavy metals and poisons and pesticides and such. And that's part of the problem with cancer, is that we are exposed to way more poisons and toxins and chemicals than our ancestors were ever exposed to. And it can overwhelm our liver. And by overwhelming our liver, then these things get shunted to the cells and to the tissues and get basically stored inside the cells. And that is a major cause of cancer, as all these poisons that we're exposed to that are stored in the cell. Could have been something you're exposed to at 6 years old and has been stored in the cell for 50 years now, and now just happens to affect the nucleus and is causing this rapid replication. So why does cancer keep growing? Well, part of the reason is that cancer is your own cells. So because it's your own cells, your immune system isn't attacking it. Secondly, cancer keeps growing because of possible hormone involvement, blocking apoptosis. Thirdly, has to do with your immune response. So lots of things that decrease my immune response will cause the cancer to uptick. We're seeing in the last few years with this advent of this quote-unquote virus, which is odd because most viral exposures actually cause an immune response to uptick. So when you have a bacterial infection or you have a viral infection, you'll end up with an increased white blood cell count. That's kind of how you know you have a bacterial infection or some sort of biotoxin, because you have an acutely spiked white blood cell count. But this so quote-unquote virus that is in society at the present time is causing a downtick of the immune response, which is quite odd, what makes you question whether there's some man-made interference of this thing. And that downtick is causing a huge spike in cancers. So how is it causing a huge spike in cancers? Well, at least one piece of the cause is it's causing a downtick in the immune response. So the truth is that all of us have some cancer cells growing in us. And what's keeping them at bay is when they get to a certain size, our immune system, even though they tend to turn off against self-tissue, when it gets to a certain size, your immune system should attack it and kill it. If my immune system is suppressed for any reason, going through a horrible financial time, I'm going through a very difficult time with my children or my spouse or my work environment, my stress is there. So stress, increased sympathetic response, decreases my immune system response, and now my immune system is downticked. If I have exposure to this weird type of virus that's causing a decrease in my immune response, or if I have a chronic infection or chronic inflammatory response, or maybe I'm exposed to a lot of poisons in my workspace, so I have a decreased immune response because my body's dealing with just an overwhelm of whatever's going on. There are hundreds of different reasons why. But if my immune system is suppressed in any way, I'm going to give an advantage to cancer growing, and that is a problem. So why does it metastasize? So cancer, as it gets larger and larger and larger, is giving off what are called circulating tumor cells. They're also called cancer stem cells. So that cancer circulating tumor cell breaks off and is going to go into the bloodstream, circulate through the bloodstream, get across the epithelial lining of the bloodstream, get into another tissue somewhere else, and look for a place to set up home and raise a family. And once it starts replicating there, now we have metastasis. So while that single cell, that single circulating tumor cell is going through the bloodstream, it's not yet rapidly replicating. And this is a problem when you're doing chemotherapy. Remember, I said chemotherapy is going to be more attracted to highly metabolic tissue. So when the cancer is growing and replicating and getting larger, it's very hungry. So it's going to gobble up more of the chemotherapy than healthy cells. But the catch-22 is everybody has circulating tumor cells. So personally, do not put your faith in a circulating tumor cell lab, because that will only pick up circulating tumor cells in that little blood sample that you collected. But your circulating tumor cells are in the blood and in the tissue. You can never find out how many circulating tumor cells you have in the tissue. So circulating tumor cells are not yet rapidly replicating. So they're not yet highly metabolic. So they haven't started the replication phase, which is setting up home and raising a family in another tissue. So they're not going to be so affected by the chemotherapy. So chemotherapy might effectively reduce the size of a primary tumor, but they really do nothing to kill circulating tumor cells. And the other negative of chemotherapy, not to knock on that because it can be very beneficial for a lot of people, but it decreases your immune response because chemotherapy is going to be attracted to rapidly replicating or highly metabolic activity, and different cell lines are more highly metabolic. Your hair follicles are more highly metabolic cell line. That's why people lose their hair when they do chemotherapy, because chemotherapy is attracted to more highly metabolic cell lines. Well, so is your immune system. Your immune system is more highly metabolic, so chemotherapy is going to be attracted to that, and that's what knocks down your immune response. And it's like, oh, dang nabbit, I thought I needed an immune response in order to kill my cancer. Well, you do. Well, that's the catch-22 of chemotherapy. So you better be doing a lot of other immune stimulation. So that's where, if you're going to do standards of care, you better be doing a lot of alternative things too to help build up your body. So I'm not against doing chemotherapy if that's the direction that God is leading you, but you better be doing some other things as well. So cancer metastasizes by giving off circulating tumor cells that is just looking for another place to grow. And different cancers tend to metastasize to different areas, partly because of location. Breast cancer tends to metastasize to the lung and the brain and the liver, whereas prostate cancer tends to metastasize to the bones of the pelvis and the lumbar spine, the abdominal cavity. Well, that makes sense because that's kind of the location of where it's at. So we need to look for that as well and treat that, and that's why make sure you're stimulating your immune response with whatever approach you're taking. So this is why finding the cause helps, because if you're cleaning up the environment, if you're trying to deal with the pesticides, the toxins, the heavy metal poisoning that you may have been exposed to for the last 30 years, or biotoxins that you've been exposed to, you're going to help prevent that metastasis to occur. So we can't stop the reason why the cancer's there in the first place by magically waving a wand over fixing the cause, but you can help reduce metastasis, and that's really the goal. It's 90-some% of the people who pass away from cancer is because of the metastasis, not the primary tumor. So we want to do everything we can to help block that. There's other things that we can do to help chelate and grab onto circulating tumor cells, and I write a lot about that in my book as well. You want to be active with that as well. So how do we address the cause? Well, how you can address the cause if you're not a patient of ours is to read my book, look at my detoxification piece, very important, and start dealing with possible causes that you were exposed to in your life. And that's the way to do it. You have to look at it holistically as much as possible. We do a cheek swab and we do some specific testing, but I know this whole series is addressed to people who can't do that and come to us and have that procedure done. So for what you need to do is you need to be looking at my 7 Phases of Detoxification book. I give a ton of information, free, that you can download and look at and utilize different things to help your body getting rid of poisons and toxins and biotoxins in your body and stay as clean as possible, because that's really the key. You're never going to be able to not have any toxins in your body. Detoxification is a lifelong process. I talk to people every day that go, well, am I going to do a detox? I don't even like using those words, because you're not going to do a detox. If you're not detoxing, you're going to die. So you are detoxing. So you're still alive talking to me. You are detoxing. We just need to help the process. We need to accelerate the process, heal the process. That's what the next module we're going to talk about is the art of detoxification and understanding those phases, because that is so key. So you don't do a box detox that you're going to do for 2 weeks and now you're healthy and clean. That's absolutely ridiculous. You're going to promote that process on a daily basis, because you're being poisoned constantly. Even if you're eating organic and doing everything possible right, you're still being exposed to poisons, and you're still being detoxified. So we want to constantly be supporting your organs of detoxification so you can help clean that out constantly. So we'll go into depth of that, so don't worry. All right, so I hope I didn't talk too fast. Maybe you have to listen to this again. I tend to ramble. I apologize. Hopefully this is a blessing to you. I really want it to be. So, all right, we'll get into Module 4 in just a second. Stick with us and walk you through this process. Thanks so much.